Hi, my name is Dee Eaton. I'm the Senior Clinical Editor at Nursing Times. Welcome to the first in a special 5-part educational series exploring support surfaces. During this series, we'll aim to provide you with a good overview of this topic so that you can optimise care for your patients. We'll also include voices from the frontline and bring in experts to give their advice along the way. Selecting the right specialist support surface for your patient, be that a therapy mattress or cushion, can make an important difference to their care outcome. We aim to get the right surface for the right patient at the right time. However, the choice can be bewildering. What is the difference between a foam mattress and a hybrid one, for example? How do you choose between a dynamic therapy system or an air fluidised one? To make that decision easier, it helps to know more about each type of specialist support surface and how they are each designed to optimise patient comfort and care. This series of 5 short videos will help you understand the range of support surfaces and guide you through the considerations to help you choose wisely. This first video will cover the fundamentals. Firstly, I'll set out why support surfaces are important and explain how they aim to reduce the risk of pressure ulcers. Next, I'll explore the different types and categories and what factors we should consider when choosing one. Finally, I'll explain the importance of matching a support surface to a patient's individual needs. You will hear a lot of terminology relating to support surfaces, terms like active and reactive, dynamic or static, or powered and non-powered. These terms will be addressed and explained throughout the series. Active and reactive technologies, for example, are covered in video 3. So let's begin with the fundamentals. Why are support surfaces important? Support surfaces are one of the important factors we need to pay attention to when preventing or managing pressure ulcers. Let me introduce Jackie Fletcher, an independent nurse consultant with a special interest in tissue viability and wound care. Jackie, the NHS has created a framework that spells out all the elements we need to consider, hasn't it? Can you tell us more about that?
Yes, I can. We've been using the Susskind framework. It's something that's been known for quite a long time across several countries. But in 2018, for NHS England, we put together an education curriculum that was based on a framework called ASKING. So we developed Susskind and added in an A and a G. So the A is about an underpinning principle. It's about assessment of risk, ensuring that we identify those most at risk. The first S is about skin assessment and skin care, making sure that we're looking for any early signs of damage. The second S is about the surface, checking that you have the right surface for the patient underneath them on a 24-hour provision and that it's working appropriately. The K is for keeping the patient moving. As we all know, immobility is one of the key risk factors, so we look at how we can maintain patient mobility or where we can help them to mobilise by repositioning. The I covers increased moisture, so most commonly we're looking at incontinence for patients, but we mustn't forget things like increased sweating or exudate from wounds. The N is for nutrition, ensuring the patient is adequately nourished, but not forgetting we need to keep them well hydrated as well, something that gets missed a lot in hospitals. And then the G is another underpinning principle. It's about giving information. And that's not just giving information to the patient, it's giving information to clinical colleagues, other healthcare professionals, and would include things like your documentation.
In this series, we're going to focus our attention on the second S of the framework, support surfaces. When a patient is lying in bed, their skin and underlying tissue become compacted due to a direct pressure, a vertical force, caused by their weight on the mattress's surface. Blood supply to their skin is restricted and tissue can be damaged. Every support surface, regardless of the design, aims to reduce the rate at which this pressure builds up on areas where the patient is lying, particularly over their bony prominences. Now we'll look at how support surfaces work to reduce this pressure. We'll talk about increasing surface area of patient contact, using immersion and envelopment to do this, the role that other external forces, shear, friction and moisture, play in development of pressure ulcers, the need to control the microclimate around the patient. We can understand pressure as an equation. Jackie, can you tell us more?
Pressure equals a weight multiplied by gravity and then divided by an area. Looking at this equation, we can understand that as weight increases, pressure also increases. So the heavier the patient, the higher the pressure on their contact points. But we can also understand that if we increase the surface area that the patient is in contact with, pressure at each point of contact will reduce.
So since we can't influence gravity or a patient's weight quickly, our only option is to influence the surface area.
Yes, that's correct. We can increase the amount of surface area in contact with the body, thereby reducing pressure. And a way to imagine this is if you think about the same patient in different positions and how we can spread the load over different surface areas. Looking at these 4 images, Which one do you think has the lowest pressure at the point of contact? This is the same person at the same weight, but each of the pressure points are completely different. In image 4, their whole weight is on one very small area. The pressure here is highest. In image 1, their body weight is spread across a much larger area, the chair, so the pressure here is lowest. To reduce the risk of pressure ulcers, we must increase the contact area between the patient and the surface.
This is what a therapy support surface tries to achieve. Let me introduce you to Lorraine Thursby, lead tissue viability nurse at George Eliot Hospital NHS Trust in Nuneaton. Lorraine, can you explain how a support surface achieves this increase in surface area?
It works in two ways. So we're looking at immersion and envelopment. Immersion is the ability of the body to sink into the surface, so that allows them to become more weightless. And envelopment is the ability of the material to actually give and contour around the patient, so they're wrapped into it and it's not causing any particular pressure in any point. So as the patient sinks down, their weight is more evenly redistributed all over the area, and the surface envelops and conforms to their shape. So the pressure on the body is more evenly distributed and less concentrated over the vulnerable areas, making the patient feel much more comfortable and more pain-free. Imagine two balls floating on a swimming pool. The first ball floats on the surface while the second sinks down, so a third of it is below the surface of the water. This is because the surface is fluid or soft and has a high ability to conform. We can see there is more immersion in the second ball. The deeper something sinks into the surface, the more immersion has been achieved. We can also see that more of the second ball's surface is in contact with the water.
So Lorraine, can you explain the experience of immersion?
The easiest way to explain it is thinking about when you're on holiday. So you've had that long, well-earned rest, you get on your sun lounger and it's quite firm and supportive, but you're going to lie there and soak up that sun. Your body's only in contact with certain points, so it's specific to the harder, firmer areas. Your children pester you to go and play with them, so you go down onto the beach, onto the lovely soft warm sand, put your towel out, you lie down, and as you lay flat, the soft sand wraps all around your body, so you're actually sinking in, you're enveloping into that lovely soft sand. Your pressure areas, or the contact points, those binding prominences, are all supported much more over the greater surface area as you sink into that lovely soft sand, so it's far more comfortable, much more supportive over the whole of the body. Envelopment describes the ability of a material to wrap around an object. So, while some materials are stiff, others are more flexible, enveloping or moulding around a given shape so the greater amount of its surface is in contact. International guidelines on management and prevention of pressure ulcers recommend increasing the patient's body surface area that comes into contact with a support surface, the contact points, through immersion and envelopment. Both these factors should work in conjunction with each other to reduce pressure.
But we know pressure is not the only cause of skin damage. Shear, friction and moisture need equal attention, as they too play a role in the formation of skin damage, ischemia and ulcer development. Friction is a mechanical force caused by rubbing two surfaces against one another. In a care setting, friction will occur if a patient's skin is repeatedly dragged across a coarse surface, such as a bedsheet. Damage to the upper layer of skin, the epidermis, typically results in redness and inflammation or lesions, also known as friction blisters or sheet burn. Shear is also a mechanical force that pushes tissue in different directions. Unlike the direct vertical pressure caused by the weight of a patient on bed, shear exerts a parallel force, causing tissue layers to move over the top of one another, disrupting blood vessels and damaged tissue due to essential nutrients not reaching cells. Shear injury will not be seen at the skin level because it happens beneath the skin, but its consequences can be very damaging. Shear strain leads to rapid cell death and speeds up the formation of pressure ulcers much more than vertical pressure alone. In a care setting, this can happen due to gravity causing a patient to slide down their bed, for example. As they slide, their deeper layers of tissue move, but their skin may not move to the same extent due to friction. This clash of movement of the underlying tissues and outer layer of skin causes blood capillaries to tear, decreased blood flow and oxygenation of the surrounding tissue, and this can lead to a pressure injury. Let me bring in Joanna Swan, Senior Lecturer in Tissue Viability at Birmingham City University. So, Jo, how important is friction in the development of pressure ulcers?
Friction is really important in the development of pressure ulcers, but shear is probably the major force that's involved. But wherever there is shear, there is also friction, so friction can't be ignored.
So is it important that we pay attention to the materials used around patients, the materials they lie on and move against?
Absolutely, it's vital that we consider these material covering support surfaces. Some materials have the potential to catch the skin and that will increase friction and shear. So we want to have materials that allow the skin to move more easily across those covers and across those surfaces.
You may have heard the terminologies one-way stretch, two-way stretch or multi-stretch. These terms relate to how flexible the support surface cover is and how easy it is for the material to move in different directions and therefore to allow the body to be enveloped in the support surface beneath the cover. Multi-stretch provides the most flexibility. The higher the stretch and movement, the greater the ability to counteract shear and frictional forces.
Some support surfaces also have a built-in design feature to reduce friction and shear.
For example, many air mattresses have a function that allows you to maximise the inflation of the surface and move or reposition your patient, reducing the risk of dragging their skin when using effective manual handling techniques.
We focus on this in greater detail in our dynamic air mattress video, video 3 in this series. It's important to note that while a support surface has characteristics that can aid with the prevention of shear and frictional forces, the positioning of the patient within the bed is another key consideration. For more information on the role a bed frame plays in pressure ulcer prevention and treatment, please watch this video within our previous series, Pressure Ulcer Prevention and Maintaining Muscle Function of Patients Confined to Bed. Moisture is the last element to consider. You will often hear the term microclimate management in relation to this. Microclimate is the climate surrounding a small area of the body, usually that in contact with the surface. In terms of patient care, microclimate management involves managing moisture and heat in a given area. Research has shown that wet skin has only 4% of the strength of dry skin, and this wet skin has a much higher friction coefficient, increasing the risk of shear forces. There are many different types of bodily fluids that can create moisture microclimate for patients: urine, faeces, exudate, sweat, or a combination of these. It is thought that in addition to the increased risk of friction and shear, skin damage associated with moisture compromises the epidermal barrier function of the skin and hence predisposes it to pressure ulcers. The cause of moisture therefore needs to be minimised throughout the care journey. It is also important to consider the impact of this moisture on the patient's skin and use materials that can transmit moisture vapour, e.g. mattress covers with moisture vapour permeability characteristics. Heat also needs to be controlled, since even small increases in our body temperature can increase our metabolic rate significantly. An increase in metabolic rate is associated with an accumulation of waste products, and in patients who may have compromised tissue perfusion, this can result in a lower cell pH and lead to cell death. In summary, when choosing a support surface, we need to choose surfaces and materials that can help reduce shear, reduce friction, and deal with moisture or manage the microclimate. Now let's look at the different types of support surfaces and what to consider when choosing one. There is a wide range of support surface technologies available. You'll be most familiar with foam mattresses, as these are the type most typically used in care settings. But there are other materials or combinations of materials that can be used too: air, gel and fluid. You may also describe surfaces based on if they need a power supply or not. Non-powered obviously avoids the need for the mechanism to be plugged into any energy source and are flexible as a result. Powered support surfaces can enable you to optimise conditions, however. You can alter the immersion and envelopment characteristics, for example, or set the device to periodically redistribute pressure. Some systems also allow you to manage the microclimate, controlling heating, cooling and moisture dissipation. Powered systems can be dynamic, consisting of continuous low pressure, alternating pressure or low air loss. In a low air loss surface like this, air is circulated beneath a water vapour permeable cover to control the humidity at the interface between the individual and the support surface. In this way, the support surface influences the microclimate. Air fluidised or fluid immersion simulation systems are also powered support surfaces. By creating an environment whereby the patient floats or has maximal immersion and envelopment in the support surface, they actively reduce loads in vulnerable areas. Characteristics of immersion or envelopment or microclimate management will vary substantially from device to device, whether they are powered or non-powered. The accompanying videos in this series will go into more detail about each type and their characteristics. The next video, video 2, will cover foam, hybrid or semi-dynamic mattresses. Then video 3 will cover dynamic therapy mattresses. In video 4, we'll take a look at fluid immersion simulation therapy mattresses and air fluidised beds. And in our final video, we'll explore mattresses for unique categories of patients, paediatric and plus-sized. My final important message is that a support surface should be matched to a patient's individual needs. In other words, our aim must be to get the right support surface for the right patient at the right time. Guidelines followed in the UK advise us to select a support surface that meets the individual's need for pressure redistribution based on the patient's level of immobility and inactivity, need for microclimate control, shear reduction, size and weight, risk of developing new pressure ulcers, number, severity and location of existing pressure ulcers, specific needs and wishes. We need to think about a number of factors. How many hours at a time will a patient be lying in bed? In those hours, how mobile are they? Can they change position? What is their age and health condition? Are they at risk of developing pressure ulcers? What is their level of pain and how well can this be controlled? Has a risk assessment been completed to guide care and decision making? How vulnerable is their skin to pressure, shear, friction, etc.? Are there times where they will be involved in specific activities, such as physiotherapy? These are the sort of questions that can help us assess a patient's needs. They are covered in various risk score systems that you can use to assess a patient. These will be covered in more detail in video 2. Patients' conditions change over time, so this means your assessment should be regularly reviewed. This may result in a step up or a step down to a more suitable support surface as appropriate. Remember, our goal is to always secure the right support surface for the right patient at the right time.